This part of exercise 12 deals with looking at the arm muscle. Muscle contraction is going to cause some type of an action at a joint that it crosses. The origin is going to remain fixed or stationary, very little movement, and then the insertion point is the point of where you're going to have that movement occur. With your arms and legs, the origin is going to be proximal to the insertion point. You can classify muscles according to the type of action. The agonist or prime mover is going to be the muscle that directly brings whatever specific action occurs. The antagonist is going to be the muscle that's opposing that. So in other words, whenever you have one muscle that's relaxing, the other one's contracting. And so you've got these opposing movements that are going to occur. So if you look at flexion, the brachialis and biceps brachii are the prime movers, and the triceps brachii is the antagonist. So you usually look on the opposite side of the bone, and that's where you're going to see the opposing movement, the antagonist. For extension, then it's going to be reversed. So it would be your triceps brachii that's the prime mover that's causing that specific type of action. And the brachialis and the biceps brachii then become the antagonist. So you have to look at each specific movement as a separate event. Synergists are going to be muscles that are working together to help kind of assist with performing whatever particular action you're talking about. Fixators are a special class of synergists. They help to stabilize the joint. They help to stabilize the muscle origin so that that prime mover can act much more efficiently then. So this is starting to look at the various arm muscles. We're going to go through some of the major ones. The triceps brachii, it gets its name, triceps, and that has 3 heads to it. It's involved with the extension of the elbow. If you look at where the muscle is, I always say learn the name of the muscle first, and then if you look at where it's located, that's going to give you clues, obviously, as to its point of origin, point of insertion, and then think about when that muscle contracts, what type of movement will you get? It all kind of falls into place that way. In this diagram is showing the biceps brachii as indicated by the arrows that are there. You can see biceps, meaning it has 2 heads to it. Please use the full name of the muscles to distinguish. I know layman's terms, often people refer to this just as a biceps, but you do have a biceps femoris as well, so you need to use the full name, biceps brachii. Types of movement that it allows for a flexion of the elbow, supination, flexion of the shoulder as well. The brachialis is involved with flexion of the elbow. Once again, you see several muscles that may be contracting together to perform a very controlled movement. The brachioradialis, flexion of the elbow, as you can see, is pointed out by the arrow on the diagram. The pronator teres, the name implies, pronation. It's allowed oftentimes remember the names of the muscles sometimes have to do with the number of heads or the type of movement or the location. So let those names, as you're learning the names of the muscles, also help you with location, with movement, etc. Use that to your advantage. The Flexor carpi radialis, where are the carpals? That's the wrist. So you know that this is going to be involved with the wrist. Helps with flexor and abduction of the wrist. Radialis is going to help you with the location of it. Palmaris longus. It is also a weak wrist flexor. All of these are on the anterior side of the forearm. Flexor carpi ulnaris. Once again, it's going to be involving movements of the wrist. It's now excuse me, dealing with flexor and adduction. Flexor digitorum superficialis. Superficialis obviously is meaning more superficial. It's not going to be one of your deep muscles. It's going to be involved digitorum with the digits, the phalanges. It's helping to move the wrist a little bit, but mainly with movement of your phalanges 2 through 5. Flexor pollicis longus is helping with the thumb now, to flex the thumb. Flexor digitorum profundus is going to also assist with flexing the phalanges and also weakly helping with the wrist. Pronator quadratus is going to help pronate the forearm. Extensor carpi radialis longus is going to be involved with extension and abduction of the wrist. The extensor carpi radialis brevis is extension and abduction of the wrist as well. One thing that may help you a little bit with trying to learn the muscles, once again, get pictures and just keep practicing, but find an initial starting point as like your marker, and then count the muscles away from that for the placement of it, and that might help. Extensor digitorum is extension of the wrist and the fingers as well. Once again, use the name. If the name has extensor in it, you know it's going to be involved with extension. Digitorum, you're talking about your digits. So just put those names together to help you. Extensor carpi ulnaris is with extension and adduction of the wrist. Supinator, what do you think it's going to be involved with? Supination of the forearm. Abductor pollicis longus, abduction and extends the thumb. And extensor pollicis brevis, also working with extending the thumb. Extensor pollicis longus. So you can have, as you can see, several muscles that may perform similar functions. They're all working together to assist with that movement. This can be a benefit if there is any type of injury to one particular muscle, that there are other muscles that can still perform that same type of movement, which is an advantage certainly to you. The muscles, I know there's a lot of them. This is just going to take time. There's no easy way around it, but just practice.